Hi and welcome to my online veterinary academy. Hope so you will be fine. I am very thankful to all of you for supporting me, by liking our content and subscribing my channel. Okay. So today I am going to tell you a very important disease in goats, mainly, in Africa, Asia, Middle East and Eastern Europe. So let's start our today's video. Today in this tutorial I will tell you about contagious caprine pleuropneumonia. Let's talk that what you will learn in today's tutorial. If you watch this complete video you will learn Introduction to CCPP, Etiology, Epidemiology and Geographical Distribution, Clinical Signs, Diagnosis, Differential Diagnosis, Postmortem Lesions, Treatment, Prevention and Control. As you know that goats play a major role in meat industry, and it is a source of food in many countries. But there are some diseases that causes about 100% morbidity, and about 60 to 100% mortality in them, and CCPP or contagious caprine pleuropneumonia is one of them. It is highly contagious and fatal disease. It was seen for the first time on European soil in Thrace, Turkey, in 2002, but does not appear to have spread to neighboring countries, Greece and Bulgaria. Outbreaks have recently been reported in sheep and captive wildlife, including gazelles and small ruminants. Now what is the etiology behind this disease? Basically CCPP is caused by Mycoplasma, Capriculum capri pneumoniae, that is Mycoplasma biotype F38. But there are some other mycoplasmas, that causes pneumonia and pleuropneumonia. Mycoplasma mycoides capri and Mycoplasma mycoides are one of them. Microcolonies of Mycoplasma, Capriculum. Subspecies Capri pneumoniae looks like fried egg. Morbidity and mortality rates are generally lower with Mycoplasma mycoides capri, and joint and udder infections may also be seen. Moving towards epidemiology and geographical distribution. As I have told earlier that this disease is more common in Africa, Asia, Middle East, and Eastern Europe. And it is transmitted directly by aerosol route through contaminated particles. Its incubation period is 3 to 4 days but it may extend to weeks. Now what are the clinical signs for this disease? Infected animals will show signs of weakness, anorexia, coughing, hyperapnea, violent nasal discharge, fever up to 104 to 106 degree Fahrenheit, open mouth breathing, salivation, and standing with limbs abducted, and neck extended. Exercise intolerance may progresses to respiratory distress. Next part is diagnosis. You can diagnose CCPP by clinical signs. Latex agglutination test, LAT. Culture. Biochemical testing. Serological testing. And molecular diagnostic tests. The causative organism should be isolated, and identified, but isolation may be difficult, and special media is required for culture. PCR, which can be performed directly on the pleural fluid, or affected lung, has greatly facilitated the diagnosis of contagious caprine pleuropneumonia. Serologic tests are complement fixation, passive hemagglutination, and ELISA. The latex agglutination test can be done in the field directly, on whole blood as well as on serum samples, in the laboratory. Serologic cross-reactions may occur, with other members of the Mycoplasma mycoides cluster. Now let's talk about differential diagnosis, that how will you differentiate it from other diseases. It can be differentially diagnosed with peste des petits ruminants, pasteurellosis, and other mycoplasmas. It can be distinguished from other goat pneumonias by the high mortality and morbidity it causes, its contagiousness and its characteristic, unilateral lung pathology. In acute cases, large quantities of pleural fluid may be produced. As there are high chances for mortality in animals, how can you diagnose if the animal will be dead? Of course you will go towards postmortem lesions. You will find Fibrinous pneumonia. Straw-colored thoracic fluid. Granular lung appearance. Consolidation of lungs. And distension of interlobular septa by serofibrinous fluid. When you examine post-mortem lesions. Now finally the thing you were waiting for, the treatment. You should know that, after the treatment there will be chance for the source of infection to the other animals. Tylosin and oxytetracyclines are very effective in CCPP at the rate of 10 mg per kg and 15 mg per kg through intramuscular route. Last but not the least is the prevention and control. For prevention and control, quarantine of affected flocks is desirable. Vaccines are available in some countries, and good to excellent protection has been reported. If the disease is not endemic in an area, slaughter of infected animals before disease can be a best policy. It was all about today. Thank you very much for watching this video. If you haven't yet subscribed our channel, then subscribe it please and click the bell icon for updates. And also tell me that how much you liked this video, and also mention in comments section if you have any question. Thanks a lot.